Patella Apprehension tests for subluxation of the patella. You push the patella laterally. If the patient contracts the quad to counteract the subluxation, that would be a positive, or any gross movement of the patella would also indicate. For patellar grind or Clark's sign, you have your patient lying supine. You apply an inferior and downward pressure on the superior aspect of the patella, and as you do that, you ask your patient to contract the quad. And a positive would be pain with contraction or inability to contract at all, and it indicates chondromalacia. Lachmans test for the ACL. So you want to grip at the distal thigh about an inch above the patella and right below the tibial tuberosity on the lower leg. And what you're trying to do is anterior translate the tibia. So any gross translation of the tibia, or if you don't feel an endpoint, like where the tibia comes to an endpoint, would be indicative of an ACL tear. The anterior drawer also tests for the ACL. So you want to have your patient lying supine with their knee flexed to 90. You can sit on their foot. It helps to prevent the patient from sliding across the table. Make sure their hamstrings are relaxed. You want to palpate the joint line and place your thumbs in the medial lateral aspects of the joint line. And you're going to be applying an anterior force on the tibia, trying to find an endpoint and testing the integrity of the ACL. Posterior drawer is a lot like anterior drawer. Your patient is supine. Flex the knee to 90 degrees. You can sit on their foot again. Prevent them from moving across the table. This time you're going to apply a posterior force on the tibia, and you want to make sure their quads are relaxed. And you're checking for the integrity of the PCL. So find the joint line and apply a posterior force. And not feeling an endpoint would be indicative of a PCL tear. Appleys Compression and Distraction both test for the integrity of the meniscus. So you have your patient lying prone, you bring their knee up to 90, and compression is going to cause symptoms and cause pain, and distraction is going to relieve those symptoms. So compression, you stabilize at the lower leg, and you're going to apply a downward force on the lower leg while you externally and internally rotate the tibia. With distraction, you stabilize the hamstrings, and you're going to pull up on the lower leg while you internally and externally rotate, and that should relieve the symptoms that compression caused. McMurrays is also for the meniscus. You do the test two ways, with the lower leg internally rotated and externally rotated. So I'm going to do it internally rotated first. You internally rotate the lower leg, find the joint line, and you're going to bring them through a full range of motion, bring them up and all the way down around, while keeping your hand on the joint line, and you're feeling for clicking and popping in the joint line, and they'll have pain. McMurrays continued. You externally rotate now, and you complete the same process, keeping your hand on the joint line, feeling for clicking and popping. You can also watch the patient's face for pain. Make sure you take them through the full range of motion, and a positive, like I said, would be clicking and popping, and that's meniscus. The sweep test tests for intercapsular fluid. So you want to apply pressure both medially and laterally as you attempt to milk the fluid up. And then you force the patella. Bloop, bloop. And fluid that pools medially would be indicative of intercapsular fluid. The Valgus stress test tests for the integrity of the MCL. And you do it at two different degree locations. At 0 degrees, you're testing the capsule, and at 30 degrees, you're testing the ligament. So at 0 degrees, you want to put your hand put your palm right on the outside of the joint, right on the joint line, and you're holding all the weight of the leg with your other hand down at the distal tibia and fibula. Relax. And you apply a valgus force, and you're looking for laxity or gross movement, and that would indicate an MCL tear. At 30 degrees, you do the same thing, but you flex their knee to 30 degrees, put your palm on the outside of the joint line, and apply a valgus force. Once again, looking for laxity and gross movement. The Varus stress test is almost exactly the same as the valgus stress test, except you're applying a Varus force on the knee and you're testing the integrity of the LCL. So once again, you do it at both 0 and 30. 0 tests the capsule and 30 tests the ligament. You place the palm of your hand on the joint line and you apply a Varus force. That's at 0. In 30, relax. Make sure your patient's relaxed. Applying a Varus force. Laxity or gross movement is indicative of an LCL tear. The plica or stutter test is done completely passively. Have the patient sitting with their leg hanging off the table. You want to hold your hand over the medial aspect of the knee, and you're going to internally rotate the lower leg while you extend and flex the knee. And your hand over here is feeling for clicking and popping, and that is indicative of plica.